all kinds of different people who've got sick, although those who are most vulnerable for either by social determinant of health or most vulnerable for other reasons, for health reasons, are most at risk. But all of people with deep information and lots of support and medical advice and all the best doctors have got sick. We don't blame people for getting sick, but we do have to come together now. Us and the vaccines against COVID-19, that's what I would say to people. It's time for us to come together and listen to public health guidance and follow those orders, especially for this period that we're in now, this period between now, really in the end of June, as we're providing everyone their first dose of vaccine.
Binder, do you have a follow-up?
I wanted to ask about the variants. There's a relatively low number, I guess, a lower number in the last couple of days, and just wondering, what is the takeaway? Is that good news? Is it a blip? And also, with the positivity rate in BC growing and being quite high in some parts, is it time to expand testing?
I'm not sure where we would expand testing, and we do have quite a lot of testing being done. We have asymptomatic testing being done where it's appropriate. Part of the reason that we're seeing higher percent positives in places like the North, for example, is because we are testing the people who are most at risk, and so that's appropriate. The fact that we've seen a lower number of variants in the last couple of days, even though our surveillance has ramped up, it's too soon to tell. We've certainly seen small numbers in different parts of the province, and we're focusing on those, trying not to let them take off. But I think there is an inevitability. There's a replacement, at least, of variants. Particularly the B117, and it is replacing the virus that we used to see because it has an ecological, or I'm trying to think of the name of it and what I'm trying to say, but it's on the end of my tip of my brain, but because it's got a survival edge. So we see this all the time, where it's able to, survival of the fittest, it's able to take over. So we are, of course, paying attention to it and monitoring very carefully, but we'll see. Most important is to reduce transmission, and we reduce transmission, we reduce all of the virus that's circulating in our community.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher at CBC.
I was just going to say it's competitive advantage. That's what I was trying to think of. So 7 has a competitive advantage and has been moving out the other viruses that we've been seeing. So sorry about that. Go ahead.
Oh, hello. I just wanted to ask about variants as well. And I know that you've said in the past that more young people are being hospitalized. We know that. And you also mentioned today that more young people are having cases with the variants. But Alberta's provincial health officer just said they're seeing more young people hospitalized due to variants. So is there updated data around the correlation between variants and young people needing critical care in BC? Are there any new commonalities emerging here about which demographics they're hitting and why, and which settings they're spreading in? I mean, you mentioned community spread, but do you have specifics?
Yeah, so I did present that data on Monday about so what we're not seeing an increase proportion of younger people who are hospitalized. So it's about the same as what we're seeing for all of the other, for any virus, about 5%. If anything, it's a little less of people who have a variant case who are hospitalized. But because we are seeing an increase cases in younger people, the numbers of younger people in hospital have gone up. And that means that the numbers, younger people are thankfully more likely to survive. So we know the length of stay is longer, and they more often are needing ICU care. So the percentage of younger people who are in ICU has gone up.